Hi, good evening to all the participants of this webinar. I am Dr. Nandini Gokul Chandran, and it's my pleasure to present this webinar to you. The webinar is going to be on recent advances in medical management of autism and cerebral palsy. I am the head of medical services at Neurogen Brain and Spine Institute, as well as a consultant regenerative medicine at Neurogen Brain and Spine Institute, Mumbai. Um, to start off with, I would just like to request your patience in today's webinar. It's not going to be short and sweet. It's going to be a long and elaborate one because there are a lot of things I need to bring forth a comprehensive total picture about how we approach children with neurological conditions, especially autism and cerebral palsy. So it may take about an hour plus, but it will be worth your time, I promise you. So here it is now. So first of all, this talk is for information purpose only. It is not a medical consultation, and please do understand that every child requires a different comprehensive treatment approach, and whatever I'm going to talk today is based on research and published data. So why are we here? This is something we ask everybody and ask ourselves whenever you attend a webinar or a seminar. Why are you here? What do you want to know? So we are here because either we have children with special needs, or we are professionals who are interested in knowing what are the new know-hows or recent advances in treatment or management of autism and cerebral palsy, or we are caretakers of such children, or we are stakeholders. We want to know what's upcoming and what's new. So in this particular webinar, I'm going to talk about four different aspects. Number one, shifting our minds or shifting our perception, shifting our understanding about autism, more about autism awareness and acceptance. Why is it important? And how different people around the world are looking at autism in a different way, which makes a lot of sense. Or gives us more, throws more light on what autism basically is. Then a little bit more scientific about what is autism, and then what is new in understanding of autism in terms of imaging and blood workup, and also what are the newer management protocols or treatments that can work together as a team. So number one, shifting our mindset about autism. The the world is shifting. The way the community or the world is looking at individuals with autism is moving from awareness about autism to acceptance of individuals with autism, or autism as part of our community. Why? Because it's time that we embrace neurodiversity. It's time that we embrace people with different personalities, people with different mindsets, people with different quirks. It's important that we accept and embrace neurodiversity because sameness or monotony is boring. Variety is the spice of life. That every individual brings something new to our life. It enriches our life, and it's important. That's why from understanding and having awareness about autism to go to acceptance of individuals with autism. So more awareness as well as acceptance. Now focus is shifted to understanding of the abilities of individual with autism rather than looking at their deficits or disabilities. And the biggest challenge, of course, change is that we have become better at recognizing or picking up the signs of autism much earlier, and diagnosis earlier, and treating or early intervention, as we say, at an early stage. So let's look at these two very powerful individuals in the world, in one of the biggest democracies in the world. What do they have to say about the statistics in autism, and why we need to be concerned about better, more awareness, more acceptance, and early intervention and early treatment? Of course, these two individuals who themselves, we will hear from them, what do they have to talk about themselves, and who have put themselves out there saying that they also have autism.
Our goal is to get toxins out of our environment poisons out of our food supply and keep our children healthy and strong. As an example, not long ago, and you can't even believe these numbers, 1 in 10,000 children had autism, 1 in 10,000, and now it's 1 in 36. There's something wrong, 1 in 36, think of that. So we're going to find out what it is.
So
Our goal is to get toxins.
let's see what Robert F. Kennedy says about
If they were,
autism.
if it was, if the autism epidemic was an artifact of diagnostic, of new or changing diagnostic criteria or better recognition, you would see it in all age groups. In my age group, 69 years old, the autism rates in my age group are 1 in 10,000, still. In my children's age group, it's 1 in 34, 1 in 22
Isn't
boys.
that because it comes with a shorter life expectancy?
No, autism does not have a shorter life expectancy. People with autism can live as long as anybody.
So this is something which we have been talking about for the last 10, 15 years. If you see any of our previous seminars and webinars, we keep talking about statistics. We keep talking about, look how the numbers of autism are going up, and really we are not paying attention to it. It is as big a epidemic or a pandemic as was COVID, as is tuberculosis, as is AIDS. So it is as big as that, but of course of a different form. But it's important to know now. What Robert F. Kennedy is saying, that it's not only because the diagnosis is becoming better, but also because there is something which is happening in what we eat, what we drink, what's happening around us, that the number of autism is increasing. It's important to pay attention to this and understand autism better.
If they were
So what does Bill Gates have to say? Bill Gates says that when he was young, he had traits of autism, and even now, if you see, he is different. He would not give so much eye contact. And let us see what he says.
You've talked about that if you were a kid today, you would probably have a diagnosis of autism. What makes you think that?
Well, the term, particularly when they say on the spectrum, that's gone from being a narrow, very narrow thing to now pretty broad. And I was very slow to develop socially. I kind of rock. I concentrate intensely. My teachers were so confused that in the same grade they said put him ahead 1 or 2 grades, and another teacher said push him back 1 or 2 grades. So that was a dilemma. My energy, my obsessions, fortunately, writing software being one of those, so that worked out well for me. Marked me out as a very different kid in terms of my neurological style.
Your ability to focus as a kid and solve problems in your head, I mean, that you write about, it became kind of a superpower.
Absolutely. I wouldn't trade it despite the other limitations that it came with.
So one of the richest man in the world is talking about him having features of autism, and what he says, doesn't it sort of resonate with you, all the features that he says, and in the end what he says is really beautiful, that it is because of his autism that he's where he is, and he would not trade it for anything in the world. So this is where also we need to start looking at our children in a different way. We need to start looking at the children with eyes looking at what they have better, what is their potential, rather than looking at what are their inabilities or what are their ineptness. So, of course, another is Elon Musk, is the richest man today in the world, and let's see what he says.
You've talked about
So that's, of course, Elon was talking about his autism, and of course we can go on. Please go and look up the TED Talk and the SNL that he is. But the point I'm trying to make here, that we are trying to make here, is that people are coming out and accepting autism. They're coming out and saying that I have autism. How many of you who are here attending my webinar have that heart saying that my child has autism and it's all right, I accept my child the way he is, the way she is? because autism now needs to go beyond the purview of stigma, and this is important for your children to be accepted in the community as they are.
Your master plan.
Okay, so that is about shifting our mindset. Now let's talk a little bit about the autism spectrum disorder itself. What is it? It's a neurodevelopmental condition. Earlier, it was thought that autism is a psychiatric condition, but Professor Kanner, Dr. Kanner from Austria, uh, 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 put forth the parameters for diagnosis, and from then we accept that autism is a neurodevelopmental. That means as the brain is developing, the brain functioning somewhere is affected, or brain development is affected either before the child is born or immediately after the child is born, due to which the typical symptoms of autism come out, which I'll be talking a little bit. And it is seen more in the boys than in the girls. We are really not sure what the real reason is. Possibly hormonal influences affect the way the brain of a male child develops versus a female child develops. And it's a spectrum. That means it can be very severe or it can be mild. And for us, both are important, but we need to make those who are moderate to severe or severe, get them to mild to be able to become individual, and those who are mild to get them to come off the spectrum. So what are the features of autism spectrum disorder? How do you diagnose? How do you understand that possibly your child has autism? You will not diagnose, but you'll pick up the signs early. You may pick up the signs as early as 14 months, 15 months, 18 months, sometimes 20 months, if you are vigilant enough. Those in families who already have a child on the spectrum, they tend to be more alert and aware, and we have seen in their families, they bring their child as early as 14 months to us, saying, I see something different in the child, similar to what I saw earlier in my older child. So what do you see? In initial on, what you see is eye contact is affected. That means the child may not look at you or smile at you, may not respond to you when you call out the child's name. As the child grows up, would like to be aloof, doesn't want to play with other people. The speech or communication get delayed, may have some words, but may not always have meaning in the words, tends to do the same thing again and again in a loop, a repetitive behavior, in the lining up of the toys or doing the same thing again and again, has problem with communication and social interaction, and is very sensitive to changes. It's very difficult for children such as these to adapt to sudden changes or to respond to external stimuli appropriately. So may have some motor difficulties. Usually these children are physically quite good, but may have some problem in gravitational insecurity, may have problem climbing up the stairs, calming down, tone of the body muscles, and doing multiple activities which are related to motor coordination. So why do we need to really talk so much about autism? Why do we need to keep on reading about autism or understanding autism? Because of the numbers. Look at the screen. What is it showing you? Between 1970 to 1995, the growth was not so much. 1995 onwards, now we are seeing a shooting up of autism, that every 2 years there is a 10 to 20% increase. And from 2010, it is much more alarming. Right now, if you say 2000 and in 2018, it was 1 in 44. Now in 2025, it is 1 in 31. Isn't that alarming? 371% increase since 2000. And 1% of the world's population, 70 million individuals in the world affected with autism. So this is a huge number, and that's why it's important that we understand more about what autism is, what really happens in autism. So parents often come to us and ask, and not often, every parent asks us, what really happens? Why did my child have autism? What is actually the problem? The child looks absolutely fine physically. What is wrong with my child? So let's try and understand this. So if you look at the causes, we can divide them into two parts: established causes and controversial causes. So what are the established causes? Established causes are genetic predisposition, and environmental factors like advanced parental age, maternal health issues, during pregnancy and birth complications. Controversial issues are, of course, vaccine, especially the MMR vaccine. So these are controversial because we are not yet really completely agreed on these factors. MMR vaccine, heavy metal exposure, exposure to electromagnetic radiation from cell phones, etc. So if you look at the common accepted causes, genetics, about 15% of autism that we see could have a genetic predisposition. The rest is environmental, and a big chunk is a combination of genetics and environmental. So we see in a family 2 children, 3 children. I've seen in a family 4 children having autism. So in a family of 8 children, the first 4 are normal, the last 4 have autism. So there seems to be some genetic predisposition which could be pushing the child towards autism. Now, if we have seen, it is known 10 to 15% of autism could be genetic, but even if there is a genetic defect somewhere, the environmental factors do push it more. On its own, the genetic may not really manifest as autism, because sometimes you see the same defect in the parent also. So the parent may not be a full-fledged autism, may have a few features. Now, when we look at the environmental factors, we will divide it into prenatal and antenatal causes due to intestinal issues, exposure to chemical in the environment, and of course mobile telephones, some of which, as I mentioned, are controversial. When we look at prenatal and antenatal causes, the most important is the mother's health. If the mother has any nutritional deficiency, has hemoglobin, low hemoglobin at the time of conception and when she is pregnant, if there is infection in the mother's womb during pregnancy, that is a TORCH infection. The TORCH means toxoplasma, rubella, chlamydia, cytomegalovirus, and herpes infection. Maternal diabetes, that is gestational diabetes, depression at the time of pregnancy, or stress during pregnancy, and antidepressants during pregnancy. The father's health, age, so if the father is above 40 years or below 25 years, possibility that the child may have a neurodevelopmental condition is high, and premature birth of a child or birth complication could lead to oxygen deprivation, leading to possibility of autism. So when you look at the father, the old age of father, a child born to a 24-year-old father or who's 45-year-old, they are more likely, 3.5 times more likely to have autism and 13 times more likely to have ADHD. Child of a father who less than 20 years also increases the risk of autism. So prenatal exposure to heavy metals, there are a lot of sources of heavy metal, right from our water, it may come from the sewage, it may be there in our food, it may be there in the fishes that we eat, in the food that we eat, agriculture, it may come through the industries, through mining. So a whole lot of contamination of heavy metal in our water, in our food, in the air that we breathe may transfer to the child when the child is in the mother's room. So the child is more affected by heavy metals when the child is in the mother's womb, and mother's heavy metal level is high. Unlike what we think that once the child is born, the heavy metal exposure, no, before that. So when the brain is developing at that time, if the lead exposure is high, the child is more likely to have a problem in the brain development. Electromagnetic radiation, another controversial cause. We know that there are radio waves all around us. One of the most common is the phone. So right from the phone, we have a very short distance electromagnetic radiation. From the Wi-Fi tower, from the data internet towers, we have a lot of radiation. So these are things you can't really avoid. But if you look at the temporal sudden shoot up of autism from 1990s, you will you can correlate it to some extent to the radio waves. So look at the towers of the 2G, the 3G, the 4G, 5G started from the 90s, and they're becoming stronger and stronger, the radio waves. So when we say that, okay, we don't want to expose our child to radiation, we are already exposing our child to so much radiation. So a little hypoxia when the child is in the mother room, and a lot of exposure to all of these tends together add to the problem. And it disrupts the blood-brain barrier. The child is developing, the blood-brain barrier is very thin. It is still very, very porous. So any contamination, any strong waves can affect the brain frequency and the brain development. It also may cause a genetic defect in the child as the child is growing. It increases the oxidative stress in our body, so healing becomes affected, and also causes inflammation, all of this contributing to autism. Does vaccine cause? That is one of the question asked to us every day. Now, way back in 1998, Andrew Wakefield, Professor Wakefield, did publish an article in the Lancet saying that there was a link between MMR vaccine and autism. And at that time, he suggested that it was more because of the thiomersal or the cryopreservant. And this publication then, however, was retracted in 2010. After that, about 25 publications came after that, which suggested that there was no correlation between MMR vaccine and autism. We do see a lot of a temporal, sometimes we see that when the child is 18 months old, and that's the time when the child has got a MMR vaccine, and that's when you see the symptoms of autism. We do not know whether it's a temporal correlation or whether it's a causative correlation. That means whether the MMR is causing the autism or whether it is just the time coincidence.
There have been, as I understand it, dozens of studies done all over the world that make it very clear that vaccines do not cause autism. Now, you just said, if I heard correctly, well, if the evidence is there. The evidence is there. That's it. Vaccines do not cause autism. Do you agree with that?
As I said, I'm not going to go into HHS with any preordained.
I asked you a simple question, Bobby. The studies all over the world say it does not. What do you think?
Senator, if you show me those studies, I will absolutely, as I promised to Chairman Cassidy, I will apologize.
That is a very troubling response because the studies are there. Your job was to have looked at those studies as an applicant for this job. All right.
So the controversy continues. So what are the causes which we divided? So we did divide it into environmental factors and of course the parent, and this is just to summarize the patient and family related factors.
At around 1 year, she had speech, but at around 1.5, she went mute.
When she was 1.5 years old, she was not giving an eye contact, not mixing with the children, and not replying to her name. So that actually triggered something is wrong.
Shihan was not at all talking, it's just everything is sign.
His focus is very poor, but very focused.
My son was completely speechless.
Never see no, you talk then you regress.
If you cannot speak, it's not safe. Even if someone is bullying you, you cannot even say and ask for help.
Challenges were really in his ability to listen to longer instructions, his ability to sit, process that, even talk.
Some of the kids tiptoes. I would see it with my girl.
Noticing more and more of abnormal symptoms, which was hard to digest.
Was not able to control himself in terms of toilets. He used to wear diapers. He wasn't able to, very picky eating.
Whenever you open the door, we had the threat of he running away. So we had to keep him contained. So unpredictable behaviors.
He was running away. He wasn't sleeping. I would stand up the whole night holding him and he would cry if I put him down.
We took her to the pediatrician. Then we got a shock. Oh, there she is suffering from autism.
When I was told about the diagnosis, first I saw the end of me. I couldn't handle them.
It's like we lost our son. He was here with us, right with us, and he is not even responding to his names.
Then what is the solution? You have to go to therapy and all.
We had several years of therapy. That did not change much for me for 8 years.
Therapies was not making any changes. Pediatricians and all say that, oh, nothing can be done.
When I saw Dr. Alok talk about the amazing results that he's seeing based on stem cell, I don't want to wait. My child is losing his time.
So this is just to show different parents' experiences, and when these parents are talking, I'm sure that is resonating with us. You have the same things that they talked about you were. So I don't really have to talk about what do you see in a child with autism. You know how do you pick up autism and what happens when you have this diagnosis, when a diagnosis is told to you really, and maybe it is the first time that you are really hearing this word autism. What really catches, what is that you hear when the doctor tells you? What really touches your mind, and what is the take home that you take? And in today's webinar, I want you to take a different message. I don't want you to take a negative message. I want you to know that there is so much that we understand more about autism now, and that there is so much that we can do for these children. So let's understand what is new, so that sort of opens up your eyes and helps you understand more. Now, today's webinar, we are going to talk about a 360-degree view of autism. We are not going to look at a two-dimensional. You look at autism as a whole. We are going to look at the brain of a child with autism, because we know that the brain is a CPU of our body, and the brain is the root cause or the root problem which needs to be understood and addressed. So definitely the brain. But we also look at the nutrients, how are they affecting the brain functioning, and how the nutrients are affected by a genetic modification or a genetic change leading to nutrient insufficiency, and all of this together, we are going to add the gut to see what is wrong in the gut and how the gut affects the brain. So then we get a 360-degree understanding of autism, and that's the new message, or that's the new understanding I want you to take from this webinar. So let's look at the neuroimaging findings. That's the first thing that we are going to do. We are going to look at the MRI of the brain, and we are going to look at the PET CT scan of the brain. The MRI of the brain, the MRI looks at the structure of the brain. So if I'm sitting on a chair and this chair goes for an MRI, what will we see in that MRI? We'll see there are 4 legs. It may be completely all right, it may be a little affected. We will see what really happens based on our own research. And the PET CT scan tells us that if I present this PET CT chair for PET CT scan, it will not only tell us that there are 4 legs, it will also tell us how strong are these legs. How, if I sit on this chair, will it take my weight? So that's what we are going to look and understand in the neuroimaging to understand the brain of a child with autism better. 95% of the time when a child is diagnosed clinically, nobody really looks at the brain. And isn't the brain the most important thing that you need to look at in a child with autism? So neuroimaging findings are very, very important. The second thing, as I said, we are going to look at the biochemical findings. We are going to look at what's happening in the blood. Then we are going to look at some key genetic findings which affect the treatment process or protocol or add to the treatment protocol. And we are going to look at the gut dysbiosis, the gut being the second brain, having the maximum neural network in our body. After the brain, the organ is the gut. So let's look at the neuroimaging. So the concept of PET scan, the PET scan is a functional scan which tells us which part of the brain is functioning less, which part of the brain is functioning more. So when you look at the brain, this is a software embedded scan, which the green indicates good functioning brain, the blue indicates low functioning brain. So three main areas which are affected in autism is, you can see the center part here is the thalamus. The thalamus is the relay center of the brain. The right side and the left side talk to each other through this thalamus. All the information goes through, passes through this, and then comes down to the lower part of the nervous system, that is the spinal cord. So thalamus is the sensory and motor processing area. The second part here you are seeing, which is circled in the red, is the medial temporal or mesial temporal. This contains two parts that you are seeing, the first three parts, the amygdala, the hippocampus, and the parahippocampal gyrus. The amygdala and hippocampus are important for understanding, learning, following commands, coordination, balance, understanding, learning, comprehension, cognition, emotional expression, and social interaction. Pardon my first mistake. So these are, this is what the hippocampus does. Cerebellum here, you can see this part which is in the back of the brain here, the light blue area. Cerebellum is important for coordination and balance and articulation. It is the traffic police of the brain. Why traffic police? Whatever the main brain needs to do, this part will finally make it happen, will execute it. So these light blue areas here are functioning less. So when you look at here, you can see some areas are functioning more. This is the frontal area. This is again for higher emotional, it is in emotional regulation. Sometimes it is low in children, sometimes high. Here you are seeing higher emotional regulation. So we published this in the World Journal of Nuclear Medicine, and something very interesting came out of it. Here, when you see this graph, this blue line is the brain functioning of a neurotypical child, where the brain functioning is increasing fast up till the age of 10, and then between 10 to 15 it is increasing but at a slower rate. So this is the brain functioning, the cortical and other functioning increasing. In a child with autism, which is this orange graph, you can see here that initially the functioning is high. Many parents tell us, my child was so well and then regressed. So you do see that initially the functioning is high and then it goes down and down and down. And what happens? At one point, it goes down so much that the gap increases, sometimes unsurmountable. So it's very important that this graph not only tells us what is happening in the brain of a child with autism, but also tells us why early intervention is important. Why? Because the earlier you start the treatment, the earlier you can push this graph up. The earlier the gap can be filled up faster. The more time you take, you can see at 10 to 15, the gap is huge. That's why we say that later you come more difficult to get the child to come off the spectrum. So earlier you treat, better the results. It's not that later you will not get results, but just look at the challenge that we have here. The other, of course, is the MRI. Now, a word about MRI is that most of the time when you do an MRI of the brain, 95% of the time you will find that it is reported as normal. So the radiologist will say the brain structure is all fine, there is nothing wrong. And when we were doing MRI, we also got similar reports, but we did not stop there. What did we do? Our research team went in deeper, looked at the softwares to have more in-depth understanding of the brain, and we found that the connections in the brain, the corpus callosum in the brain is definitely abnormal and delayed in development in autism. So you see here, this is the corpus callosum. This is the bundle of nerves which are sent by the neurons from the brain. So just imagine hundreds of wires coming from the neurons, and then they bundle up from front to back and from side to side, connecting all parts of the brain. This very important structure, the posterior part of that is thinned out in autism. And we are seeing that more often now. So this is what the Sergey original study that we researched and found. So the corpus callosum is the mediator, is the connections which passes through the relay center, that is the thalamus. And since it is functioning less, different parts of the brain find it difficult to work with each other. So the information processing and information transfer system is affected in many children with autism. So that was about the brain imaging. I hope that was useful. Now we will come to the biochemical findings. So this is the brain functioning is low. So that means that needs to be taken care of. What else is affected? When we look at the blood, we are doing a lot of research and looking at the blood of children with autism, and we find that many of these levels of nutrients is working less. Then what do we find here? When we look at folic acid is a part of B complex vitamin. It is B9, like you would know B1, B2, B3, B6, B9, B12, very important. So B9 is folic acid, and folic acid is very important for brain development. So, but this folic acid, which comes from the food into our intestine, gets absorbed and goes into the blood. From the blood, every cell needs to convert it into a usable or an active form, that is L-methylfolate. So the folic acid has to be converted to L-methylfolate. Okay, this is the active unusable form, which is important for the following function. It is important for synthesis of DNA and repair of the cell and repair of the DNA. It's important for neurotransmitter production, directly important for various neurotransmitters in the brain affecting the child with autism. And it is important for the use of homocysteine, that is the next level. So these three things, very important that this particular metabolite we form. In autism, we are seeing that the folic acid doesn't get converted into 5-methylfolate, and it gets accumulated in the blood. So sometimes you see very high level of folic acid. Sometimes you also see very high level of B12, and you wonder, you have not given your child so much. How is it remaining there? Because it is not getting converted to active or usable form. So that's why even if the folic acid level is high, or sometimes it may be low also, it is not getting utilized properly, and thereby resulting in impaired detox, impaired neurotransmitter formation, impaired DNA repair and synthesis, which affects the behavior of the child, the cognition of the child, the mood of the child, and social interaction. So what do we see here? In the blood, we also see that there is a discrepancy or an imbalance in many of the amino acid and neurotransmitter. We see that the glutamate levels are high, which leads to anxiety and sensory issues. The GABA is low, so that leads to poor impulse control and hyperactivity. Serotonin is low in the brain but high in the blood. That means from the blood it is not going to brain, and in the brain finally we see it is low. There are mood swings and poor sleep because melatonin is not produced. If serotonin is not produced, melatonin is not produced, and melatonin is not produced, sleep is affected. Then dopamine is low, that leads to poor focus and repetitive behavior. Norepinephrine is low, so poor attention and low motivation, and oxytocin low, leading to less emotional bonding. So these are some of the findings that we are currently uncovering and has been also shown in research. So that was about the blood levels. Now let's look at the levels of what's happening to the folic acid. Why do we say that folic acid level is high but folate is low, methylfolate is low? Because of certain important gene defects. Now, this may be related to autism, but may not be the causation of autism at this point. We do not know. But here, what we are looking at the gene defect is to look at folic acid metabolism. That means how does folic acid work without MTHFR gene functioning? So there are children with autism. We are finding that almost 70 to 80% children with autism have this particular gene defect. That means there is a spelling mistake in the DNA or a gene which prevents the folic acid from converting into 5-methylfolate. So this gene defect cannot be reversed. People wonder whether stem cell can reverse it. No, it cannot be reversed. But what we can do is that we can supplement the child or the patient with the active usable form, the methylfolate. So once we know that this is the problem, then the methylfolate supplementation can be done. So we are seeing this in many children. So our research shows that MTHFR mutation in 80% autism individuals, and they have high folic acid level. And because the folic acid level is high and methylfolate is not formed, so homocysteine is also high. That means that the methylfolate has to give a methyl part to the homocysteine for its use. That is not happening. So homocysteine is getting accumulated in the blood, that is again in an inactive form, and there is decreased vitamin D level, which also is important for all of these energy cycles, and there is elevated B12 levels in the mother and sometimes in the children also. So that was about the blood, what you see in the blood and how the MTHFR gene mutation affects these nutrients in the blood. So we looked at 3 parts of the 360 degree. We saw the imaging, that is the 90 degrees. We saw the blood nutrients 90 degree. We saw the gene mutation 90 degree. The last 90 degree here is the gut dysbiosis. So people talk about the gut-brain axis, right? And we also talk about the brain-gut axis. Now what happens is that when the brain functioning of a child with autism is low, this will lead to the gut movement or mobility to become low. So when the gut mobility is low, the child will have constipation, will have a lot of gas, will have sometimes improper digestion. That leads to a lot of fecal matter getting accumulated in the intestine. That leads to 2 things. It leads to improper absorption of whatever food or nutrient that he's taking. And number 2, over absorption of toxins which remain in the gut and are not removed from the gut because of constipation. Now that leads to, as the toxins get absorbed, they go and affect the brain functioning, and that's the leaky gut. So the leaky gut comes later, but the leaky guts affect the brain. So whenever we look at any repairing a system, we need to repair both. We need to repair the brain functioning and we need to cleanse the gut. But let's look at what's happening in the gut. So 70% of individuals with autism have significant gut issues, and that is then linked to their behaviors, digestive problem, also because nutrients are not being absorbed, immune dysfunction, and neurotransmitter imbalance, because the gut does produce a lot of neurotransmitter as well. So a lot of things, if you have constipation or if you have loose motion, if you have gas, just imagine how uncomfortable you will be, and multiply that by 10 or 20, and that's where a child with autism is. So the gut dysbiosis is an important issue which needs to be addressed. Now, what are we seeing in the gut? We are seeing that it has abundance of unwanted bacteria. All the children that we have checked for, we have found bacterial overload of unwanted bacteria of E. coli and Shigella at 47 and 59% of children. That leads to repetitive behavior, social communication deficit, problem in the memory. Shigella recently also may stimulate seizures and drowsiness, and increased hypersensitivity. Fungal, Candida and Aspergillus niger, very common fungus in the gut. That leads to a lot of behavioral issues, jumping, hyperactivity, stimming, laughing without reason. Aspergillus leading to problem of social communication and interaction, restricted repetitive behavior. Protozoa, or that is Cryptosporidium, like you can say, very early form of worms, may cause diarrhea, stomach cramps, and nausea. So these are common gut issues or gut microbiome, which we need to correct. Now, this is a 360-degree understanding of autism that we have got by looking at different parts of an autistic individual. Now let's look at how this helps in creating a process which is again 360-degree and holistic for a complete management of autism. So what is new in the treatment of autism? What is new is, of course, the pillars, the main pillar of autism treatment is comprehensive rehabilitation. So that is extremely important. We would never negate the importance of the same, and there is no substitute for comprehensive rehabilitation, but it is not enough. We do see that, just doing comprehensive rehabilitation may not be enough. So along with that, of course, cellular therapy and oxygen-based integrative therapy, along with nutrient mobilization. So let's look at what all we need to do. So neurorehabilitation along with the cellular therapy, hyperbaric oxygen therapy, ozone therapy to cleanse the gut, a gut detox plan, and deep tissue mobilization. So this is the holistic, comprehensive, multidisciplinary treatment approach that we propose. So the old thinking is that the brain, once damaged, cannot be repaired, but the new thinking is that regeneration through a process of cellular repair is possible. And that's where the concept of cellular therapy or stem cell therapy comes in. It may also be called as regenerative medicine, stem cells, or cellular therapy. What are stem cells? Stem cells are cells in our body, just the analogy to the stem of a tree. As the stem of a tree gives rise to branches and leaves and flowers and fruits when given proper growth factors. Similarly, there are cells in our body which multiply, and depending on where you put them, they can, if you put them in liver, they can become liver-like cells. If you put them in the heart, they can become heart-like cells. If you put them in the brain, they will help regenerate the brain cells. You can see here the PET scan. The blue part is a damage. The cells will go there. They will release growth factors and they stimulate, and the blue part becomes smaller and green becomes more. So that's the healing of the brain from inside. So just as we would, if you have a fracture of the leg, what would you do? Would you start doing exercise immediately? No, you would first fix the bone, isn't it? You would fix the bone and then you would do physiotherapy to strengthen the muscles. Similarly for the brain, right now when we have a child with autism with a brain which is low functioning or suboptimal, what are we doing here? We are pushing the child to do things which he or she is not capable of doing. And then you see the tantrums and the behavioral issues, and child unable to do it is rebelling. So we need to heal this blue area. We need to heal the part of the brain which is damaged or functioning less. And once we heal the brain, then all the therapy, then all the nutrients, then all the gut mobilization and gut clearance will be effective. So we need to fix the CPU of the body first, and then everything will work smoothly. So how do we define stem cells? If you look at a few years back when if we needed to click a picture, you needed a Kodak or a Canon camera. If you need to listen to music, you needed a tape recorder. If you needed to call someone, you needed a landline phone. If you needed to read a book, you needed a hard copy book. If you needed a compass, you needed a compass, right? If you had to look at where maps, you needed an actual physical map. But now what do you have? You have an Android or an iPhone which does all of these things. Stem cells are like these. All the different medications that people give, stem cell has multiple action. It is a multimodality tissue or multimodality process. So what can stem cell do in neurological condition? It can first multiply and can differentiate into neurons. It can release growth factors, or it's called trophic factors or paracrine effect, release of growth factor which is stimulate other cells. It will form new blood vessels, that is angiogenesis, leading to more oxygen supplied to the part of the brain which is inflamed or damaged. It will help in myelination of the neurons. It will help in immunomodulation by reducing the inflammation. It will prevent cell death, and it eventually forms neurons. So it has multiple action, just as an Android phone or an iPhone would have. So what is the proof? What do we have? How do we know cell therapy works? Because of worldwide publications. There is so much scientific evidence. If we go and look at it, we do not want to look at it. Right? So in neurological disorders, there are 291 publications. In orthopedic condition, there is 130 publications. In wound healing ischemia, 126, and this keeps on adding every day that you look online in PubMed index papers. In neurological conditions, in autism, there are 33 publications, cerebral palsy, 44 44, spinal cord injury 68, head injury 12, brain stroke 38. So many publications and scientific publications are there. These are not newspaper articles, these are scientific peer-reviewed publications in scientific journals. Even the Harrison's textbook of medicine, which is like a Bible for us who go into the field of medicine, there is a chapter on the on regenerative medicine, which talks about stem cells, which talks about the utility of stem cells in various genetic conditions, and Alzheimer's, and traumatic brain injury, Parkinson's. And of course, there is Nobel Prize in the field of regenerative medicine 3 times in the history of Nobel Prize. No other field in research has ever been awarded a Nobel Prize 3 times. First in 1990 to demonstrate stem cells in the bone marrow. So that's one of the oldest finding, almost in 1990. So it's almost 34 years back, 35 years back, that this Professor Thomas was awarded. And just imagine that he must have done research for at least 20-30 years before that. So this concept or understanding is there for 60 years plus. And the isolation of embryonic stem cell from the mice came in 2007, and the induced pluripotent stem cells are customized or designer stem cells from 2 scientists got awarded in 2012, Shinya Yamanaka and John Gordon. So how does cellular therapy work? What do the cells do? Many people want to know. Okay, you put the cells in, what does it do? So when we put the cells in, the first thing that they do is they multiply. One cell becomes hundreds of cells. Then they reach the part of the organ which is damaged. Here I will be talking about the brain. It reaches near the brain. It is attracted by chemoattractants. The part of the brain which is damaged is inflamed, attracts the cells towards it through the process of chemotaxis. And then there is release of growth factors. You can see there are multiple growth factors and immunomodulators which are released. It reduces the inflammation in the brain, and those areas in the PET scan which I showed you, the blue areas, they are stimulated, they start functioning better. It's like, waking up those cells which are sleeping. Then over a period of a few days to a few weeks to a few months, there is a formation of new blood vessels. So new blood vessels, when they increase in the brain, they release growth factors, they release oxygen, and thereby further enhancing the repair capacity. Finally, a portion of the cells will become the neurons. Now this happens over a period of 2 to 3 months, and during this time when you do training and rehabilitation, the networking happens. The connection is very, very important. Just stimulating the brain is not enough. You need to convert that into signals and networks as well. So the cells go and repair, regenerate, and replace the damaged tissue. So in ASD, what does it do? And the same thing that you would do in any other organ, angiogenesis, formation of new blood vessel, paracrine effect. So you can see growth factors are released, they'll go and attach to the next cell which is functioning less, get absorbed, and they stimulate. Neuronal stimulation will happen, and the apoptosis prevents the cells from dying off prematurely, protects the brain from inflammatory molecules. So it has anti-inflammatory and immunomodulatory effect, and has self-renewal capacity and improved synaptic plasticity, that is connections. So it also helps to form the connections. So the cellular therapy can be of 2 types: autologous, taken from our own body, put back into our own body, or taken from somebody else and put in our body. So that is known as allogenic. So what are the major types of stem cells that we know? One is embryonic stem cells from embryos, 3 to 4 days embryos from in vitro fertilization clinics. From there, when these cells are derived, you can make any part of the body. It can form everything, including the placenta. And this is known as embryonic stem cell. However, because there are ethical issues surrounding it, and there is a possibility of tumor formation only in embryonic stem cell, it is not to be used for clinical transplantation. It is a very good modality for doing research for drug drug activity, rather than using animals, you can use embryonic stem cells very safely and without any ethical issues. For treatment purposes, embryonic stem cells is currently not to be utilized. But there are other sources that have no ethical issues, no ethical problems surrounding it, and that is umbilical cord cell, the cord which connects the child to the mother when the child is born, that goes into the garbage, and that has a lot of cells in it, and those cells can be stored at -190°C. So far they are deemed to be useful best for hematopoietic disorders or blood disorders like sickle cell anemia, thalassemia, and leukemia. But we do have cells in our own body, which Stephen Hawking spoke about, the adult stem cells. The adult stem cells are cells in our bone marrow, which continue to produce blood till we die. That means these stem cells are active till we die. And these bone marrow cells are very good source of, ethical cells with no tumorogenicity and no possible side effects, can be used for treatment purposes in various disorders, including arthritis. So, of course, pluripotent stem cells, induced pluripotent stem cells, or iPSC cells, are again under a lot of research, where your own cell can be reprogrammed to become embryonic stem cell, thereby circumventing the problem of any ethical issues, and then can be used for treatment in you. So it becomes your cell. However, this is still in the process of being understood, and being still a lot of blocks and problems of genetic or gene defects coming up during the process of multiplication. So all those problems are still being sorted. So, but we do have two possible sources: adult stem cells and cord blood stem cells, which can be used currently. So definitely adult bone marrow stem cells can be used without any ethical issues. We at Neurogen, we use adult bone marrow derived mononuclear cells because they are safe, they are non-tumorogenic, no rejection issue, easily obtainable, and no ethical issues. We are not killing animals. So it can be administered in different ways, and the most simplest way is to administer intravenously, right? So if you inject the cells IV, most simplest, even a nurse can do it. How does it go? What part does it take? It will go through this, then it will go to the right side of the heart, right? From the right side of the heart, it is pumped and it goes to both the lungs. Here in the lung, it gets filtered. 50% of the cells will get, sequestered here. And from here, as the blood gets purified, it goes back to the left side of the heart. And from the left side of the heart, it will get pushed to all parts of the body. So these cells will get diluted and diverted to different parts, and it will finally reach the brain. And then when it reaches the brain, how much of it can actually enter the brain is also a big question. So though it's the simplest route, it has very low efficiency. The other route is, of course, intranasal. And when you put cells intranasal, like in inhalation, many of the cells do get trapped. In children, it may reach the brain. In adults, it will not. So because of the porosity of the bone through which it has to traverse. So again, we don't know how efficient this mode is. Intramuscular is a good way for muscular disorders, because from the muscle, how it will reach other parts, we do not know. And intraarterial, again, the artery. Intraarterial is a good way for pancreas and other parts. So we'll have to look at what works best for the brain. For the brain, if we look at maybe the directly injecting into the brain directly through the skull, maybe the most efficient, but again, it has a lot of mortality and morbidity because you're going into the brain. It is extremely risky, but you may also be going through normal tissue and damaging normal tissue during that. So on one hand, you have something which is very simple. You can go through IV, but possibly very low efficiency. You have the other end of the spectrum, that is injecting directly into the brain, but again, very, very risky. So what we found is something in between this. So it is something which is simple but not as risky as the intracerebral, intraventricular, and so we found the intrathecal route. When we inject the cells here into the spinal fluid, the cells do not have to go through the bloodstream. They are going directly into the vicinity of the nervous system. It has already crossed 2 out of the 3 meninges, that is the blood-brain barrier. Part of the blood-brain barrier is already crossed, and the cells, through the process of going through the CSF, they move with the help of the cilia, they're pushed up and it goes to the brain directly. So it will not go through filter through any of the other organs, go directly to the brain. But here there is no risk of damaging the brain because you are injecting very low. So simple as well as minimally invasive and safe. So 3 steps of the process. The first is taking the bone marrow from the hip bone. So it's not in the joint. See, where are we taking the bone marrow from? Here, not in the joint. So from what is called the iliac crest, if you put your hand right in the front of your abdomen and you try to feel yourself, you will feel the bone. So right in the front, you see feel the bone. This is the bone. This is where the bone marrow is taken from. And once the bone, it is a 10-minute process under intravenous sedation, anesthesia, and once the bone marrow is taken, it is sent to the laboratory where the separation will happen. And then these cells which are separated, known as the buffy coat or mononuclear cell, then injected in the lower back into the spinal fluid. See, very, very thin needle, no cut, no stitches. This is a process, taking the bone marrow, the child is sleeping, separation of the cells, and then injected in the lower back using very, very thin needle. People want to know how thin, just look at it, very thin, thinner than what you would use for withdrawing of the blood. Okay, so this is how the process is done, and let's look at the scientific proof of really how much it works. So if you look at worldwide publication, first came from India, from Eurogen, then second came from China, third from Italy, fourth and fifth from the US, sixth again from India, from us, seventh from Vietnam, eighth from Iran, and ninth from the US. The first ever publication, and that came from Eurogen, 32 patients we looked at, and we found 91% improved, 91% patient improved in various domains. This is the second publication in 2020, published in the American Journal of Stem Cells, where we looked at data of 254 patients, and we found that 95% of the patients improved. We found the best results in children less than 5 years, 98%, 5 to 10 years, 95%, 10 to 15 years, 90%. So with age, there is a 5% decline. We looked at the brain scan. We looked at before and after. Before the treatment, you can see a lot of blue areas. 6 months later, it takes at least 6 months to show the improvement. You can see that the blue has become lesser blue and more green. So this is where the repair of the brain is happening. You can see the blue area has become more green. The third is in preprint, still being reviewed, which collates the data of 1,011. This is our data, 1,011 patients. And we find improvement, 82% improvement in attention, concentration, 80% in command following, eye contact in 78%, sitting tolerance in 70%, social interaction 65%, hyperactivity reduction in 65%, communication in 67%, speech improved in 60%, and so on. And we look at different parameters, the clinical scales, we see improvement in them as well. And all the different domains, there is an improvement which is statistically significant. When we look at overall, we find age-wise best results in 0 to 5%. But when we look at doing treatment multiple times, we find that with one dose, there is 71% of the patients improve. And when we are doing 2 treatments 6 months apart, we see there is an increase in their development to almost 96%. So 96% of children who do second treatment show improvement. So that's why we find that doing 2 treatments about a year, between 6 months to a year apart, shows significant long-term impact. Again, the brain scan, which I showed you. So worldwide data, let's look at other people who have done. This is, of course, our publication, which I told about. About 32 patients, 91% success rate. Second paper from China in the same year showed that out of 37 patients, they combined cord blood cells and umbilical cord mesenchymal cells, giving them both intravenous and intrathecal, showing 88% success rate. The next publication from USA, the Dawson et al., they gave cord blood infusion intravenous and found that it was safe and showing 90% showing improvement at 12 months post-intervention. The next paper from US, Kimberly et al., again looked at 25 patients and they found that 90% showed better behavior, significant improvement in the behavior. This paper from Mexico, Martinez et al., using bone marrow mononuclear cells also showed 95% success rate. And from Vietnam, the same bone marrow derived cells showed 93% success rate. So bone marrow mononuclear cell treatment seems to be safe uniformly in all the centers which have used it, showing more than 90% success rate. Italy, they used the fetal stem cells and they found 78% success rate. And in Mexico, this paper from Mexico was actually a meta-analysis, a review of many, many different studies put together. And they found that cellular therapy in autism is safe and it improves the individual clinically also. Again, this meta-analysis from China looked at 325 patients' data put together by different people and found that cell therapy for autism is safe and effective. So that was about the cell therapy. Of course, as I said, neurorehabilitation is a very, very important part. I would like to run through it in brief in a few minutes. Why it is important? Because we believe that using the cellular therapy and hyperbaric oxygen, we are repairing the hardware. We also need to put the right software. Because if we don't put the right software, the child will take information from anywhere that the child gets and may pick up wrong things. So the cell therapy is the hardware while the rehabilitation is the software. So very, very important to combine the hardware and software, otherwise your computer will not work. So speech therapy, psychology, physiotherapy, occupational therapy, aquatic therapy, diet and nutrition, special education, sensory integration therapy, art music therapy, play therapy, behavior therapy, all of this comprehensive rehabilitation is important. Conventional, we know, behavioral therapy, psychology, occupation, speech, but new is sensory integration therapy and aquatic therapy, very, very useful. So ABA, I don't need to tell, most of your children are undergoing ABA. It helps the child to be taught what is the right kind of behavior and where he should behave how appropriately, very important. Occupational therapy teaches child occupation. What is a child's occupation? Child's occupation is to play. The child's occupation is to eat, to sleep, to be able to take care of his own potty and pee-pee. So occupational therapy helps the child to reach all those milestones appropriately. So occupation, to teach the child his or her occupation. Speech therapy, not only does the speech therapy teach about speech and language, but also communication. The communication can be verbal and non-verbal, both are important. Physiotherapy, though we see that the child is physically absolutely fine, but there are impairments of motor coordination, clumsiness, tone of the body is all affected. Art-based therapy, children love art, and when you use art to teach, they learn better and faster. It can be music, it can be drawing, it can be artwork. Sensory integration, very important. If you remember, I showed the part of the brain between the two hemispheres is the blue part is the thalamus. Thalamus is the part for sensory and motor integration, and that is affected in children with autism. Sensory integration means what? That whatever information is coming, whether it's as vision, as hearing, as touch, as smell, is inappropriately processed in the brain, and thereby the output is inappropriate. So it doesn't mean that children don't have senses. They respond inappropriately. Either they respond very less or they respond very high. So they are either hyposensitive or they are hypersensitive. And this appropriate information processing needs to be taught. So yes, a cell therapy will improve the brain functioning, but sensory integration therapy is also important. Aquatic therapy, children love water. So when they do activity in water, they learn better, their focus improves, their sensory issues reduces, cognitive function improves. So there's so many, they sleep better, their energy gets utilized. There are so many things that children love, learn when they do it in water. So rehabilitation, how does it help cellular therapy? It promotes cellular integration and survival. Cells know where to reach and they know better with rehabilitation. It improves blood supply and oxygen supply. It improves connections of the neurons. It improves synaptic plasticity, formation of new neural pathways, reduces the inflammation and promotes the release of growth factors and cytokines like the cell. So that is about neurorehabilitation. The third aspect of our comprehensive treatment would be integrated therapies. Integrated therapies include hyperbaric oxygen therapy, ozone therapy, gut cleansing and diet, acupressure or deep tissue mobilization, supplements, vitamins, micronutrients. So hyperbaric oxygen, ozone and gut cleansing. Let's look at hyperbaric oxygen. What is hyperbaric oxygen? Oxygen given at increased pressure. What we are currently breathing is 20% oxygen in air. This 20% oxygen we are breathing at 1 atmosphere pressure. At 1 atmosphere pressure, this is how the blood would look like. This is the blood and you can see the red blood cells here. So in 1 atmosphere pressure, the oxygen will be carried inside the red blood cells only. Even if you give 100% oxygen at 1 atmosphere pressure in the mask, the lungs will take up the oxygen and it will push it into the blood, but only the red blood cells will carry it when you do it at 1 atmosphere pressure, which is the normal pressure. So in hyperbaric condition, you are introducing oxygen at increased pressure, 1.3, 1.4, 1.5, 1.6. In this pressure, see the difference. In the lower part of this picture, you will see oxygen is there, not only in the red blood cells, but all into the plasma. It diffuses everywhere into the plasma. So your whole body is flushed with oxygen, and oxygen is the repair molecule. Repairing molecule repairs everything in our body. It heals all our ailments. It heals all our wounds. So this increased oxygenation all over, especially in nook and corner of the brain, even where the cells are not able to reach, helps that part of the brain to heal. It stimulates the stem cells, endogenous stem cells in the brain. It also stimulates the stem cells that we have injected into the brain, and it helps those cells to survive longer and to graft in longer. So this is the importance of hyperbaric oxygen. And having started cell therapy with hyperbaric oxygen, we have found beautiful synergy in their mechanism of action. The second part of our oxygen integrative therapy is ozone therapy. What is ozone? It is medical oxygen is O2, ozone is O3. So O2 converted to O3. You can see here O2, O1, O2 combined with a very strong bond. This is the natural oxygen. And here you see ozone. When you push the oxygen and force it to become an ozone, it is the combining or the connection is very, very weak. So this is an activated oxygen, and activated oxygen can be introduced into a child through the ear using a stethoscope. This is an ozonator, and you can see it is connected to the ear. The other thing we do is rectal ozone given as a enema, and the third is ozone cupping around the mouth part to improve the oromotor muscle in nonverbal children. So these are the 3 ways that we are introducing ozone into children. In adults, it can be given intravenously, it can be taken as a sauna. There are very different ways. It can be given in the knee for knee problem, but here I'm talking about children with autism, so we are focusing on these 3 modalities. Now, So what does ozone do? Ozone, when given rectally, ozone cleanses the gut, and it's a natural germicidal. It will kill unwanted bacteria, fungus, and parasites very easily. So it helps to cleanse the gut. It also gets absorbed into the bloodstream via the intestinal mucosa and goes to the liver and detoxifies the liver as well. The ear ozone will go directly to the brain and reduce the oxidative stress in the brain and help the cells that we have injected to survive longer and better. The ozone cupping will help the oromotor muscles here to improve so that the articulation of the child will improve. The third is deep tissue mobilization, giving points of pressure at specific points in the body, which helps to improve relaxation, improve the motor movements, restores muscle functioning and tone. It reduces and helps reduce anxiety, improves the sleep. Now, the other part of the integrative therapy is the gut detox plan based on what you eat, very important. So it starts with the gut microbiome testing, looking at what's wrong with the gut, and then based on that, identifying the pathogens which may be affected, and then doing a treatment in a three-phase manner. The first phase is restoring of your gut microbiome, so killing the unwanted bacteria, then rebuilding your microbiome, adding the probiotics, and number 3 is maintaining the healthy gut, so that is the diet. So these are the 3 ways that we would do the gut detox plan. Along with that, of course, is the rectal ozone and restoration of gut balance through dietary recommendations. Diet, in short, what to eat and what to avoid. Eat more probiotic, prebiotic, gluten-free, casein-free diet if possible, vitamin-rich food, camel milk if possible, and fermented foods are recommended. Not to eat is sugar, additives, aerated drinks, genetically modified meat or food, inorganic processed food, and hard to digest starch. Vitamin micronutrient therapy, mostly for children, it is oral. For adults, it is intravenous based on the deficiencies. We do the MTHFR gene mutation test. Based on that, the supplements would be recommended. So, synergistic effect of cellular therapy and HBOT, enhanced oxygenation. Ozone therapy enhances cellular utilization. HBOT enhances oxygen to the brain tissues. Ozone reduces systemic inflammation and oxidative stress. HBOT reduces neuroinflammation. Ozone therapy enhances the mitochondrial efficiency of the body because many children with autism have mitochondrial dysfunction, and HBOT boosts the oxygen energy production in the body. HBOT also, ozone enhances activity of antioxidant enzymes. HBOT improves the circulation and helps in toxin detoxifying. So of course there are so many, it helps in immune protection, neuroprotection. Both of them do sometimes increase user frequency, so you have to be careful when there is epilepsy or seizure along with the autism. Behavioral and cognitive improvements can be seen. So outcome of, when we compare outcome of cellular therapy alone and cellular therapy with integrative therapy, we did a comparative study where 714 patients got only cellular therapy with rehab, 732 got cellular therapy with rehab with integrative therapy, and this is what we found. Only cellular therapy, we found 87% improvement, and while in cell therapy and integrative therapy, 91% of the patients improved. And the qualitatively and quantitatively, all the different parameters or symptoms improved better when the cell therapy was combined with integrative therapy, almost to 5 to 10% more. PET scan also, we saw that PET scan improvements were more when combined cell therapy was combined with.
When we came here to Neurogen, she was totally nonverbal. She had no speech. Immediately after the first shot of stem cell, that's when she started now having one word.
Less than 2 weeks from that, he was using single words like
C4.
Magically the water came out from the mouth, mama came out from the mouth.
Therefore,
I remember the first day she called me mom, I cried. I cried because it was so emotional.
Within about like 40 days, a remarkable improvement. Her eye contact is fabulous. She started sleeping on a time. That is wonderful.
Biggest game changer for Prithvi is his expressive language, his speech. He started speaking more. He even started telling us what's going on in school.
He's able to listen, and he's able to understand more, and he's able to learn new things.
So after stem cell, what I saw was he was able to read sentences in his mind.
He has improved his eye contact. If he wants water, if he can't reach, he'll come and ask he wants water. We gained so much progress in less time.
She started responding to her name.
Is Eliana a big?
No.
Eliana is a?
Eliana is a good girl.
Then his writing has improved. He can read single word to sentences.
My girl finally she hates speech. Please give me food. Can we go for a shopping?
Blueberry.
Cranberry.
And orange.
Orange.
And mixed fruit.
Mixed fruit.
High five. Now he is able to put things in sentences. Let's put on our shoes. Let's go to the car. Let's go to the plane. Let's go home. You feel now, yes, you got your life back.
She improved her performance in the school. Her behavior has improved. Her understanding has improved.
There are certain things which I have never taught him. Huge improvement in academics, English language, Bengali, that's Bengali is his mother tongue, and also a little bit of Spanish. He can tell you the date 7th February 2030. What will be the day?
From special needs self-contained class into a gen ed class, he would come and say, I got 100 in math today. I was the only one who got 100 in math.
My child started showing this extraordinary education skills. He can do calculations, he can do square root, cube root. I have also tried a little bit of cos theta, tan theta, which is class 9-10 level with the options, and he has also given that.
The boy who was not responding, even if you call his name at the beginning, he is now, when someone walks into the room, he spontaneously, automatically says hi. He is able to grab and tell you to read for him, and you sit down and listen and watches and you read together. And he reads after you, and he's able to write. His handwriting improved.
Now I'm not scared that he would take off and run away, because I think he goes out of the house and he knows what he wants to play. If I say it's dangerous, come back, he comes back. So that stress is reduced.
I taught him my phone number for emergency purpose. I also taught him the address. He is able to tell me full address, and he is able to write it down so that if anything happens, he is able to say my phone number.
He understands emotions. If you're happy, he's happy. If you get upset, he knows you're upset. I have seen a lot of huge differences. It's like giving a second life to a child by doing the stem cell.
She could do short call on her own, but long call with support. But after the second one, she is fully trained.
हर बार stem cells से improvement है, and the improvement are permanent.
We've seen significant improvement, hitting all his goals, and in fact we are now figuring out what are the new kinds of challenges we need to set for him.
There are children with a special need, so they come to us and speak to her how Saisha is doing such a good.
My child has got some ability to fall back on and to make that as his career or the reason why he is here in this world.
The stem cell is a hope for a parent. You might not see the results in the same day or the same minute, but you can see faster and much better results.
He has, the two big sisters are both of them public health nurses. My mom is a nurse, and we are a medical family. We see and observe him every single day, and we ask ourselves, it's just a few more years, Abdul Hakim will be independent.
So I'm going to go to cerebral palsy now, because I think talked a lot about autism. Of course, there are a lot of other case reports to show. This is one of our favorites, Ganesh. He is from US. He's now 20 years old. He came to us with mild autism when he was 11. Now he's off the spectrum and he is in college. Of course, there is Drake. He's doing wonderful. He was again on mild. Now he's high functioning and going to regular school. Of course, you saw about Emma. This is the brain scan. You can see the brain. This is the brain before the treatment. For Elena, blue areas becoming green. This is what the mother was telling, one of the first mothers in the video. So this is one of my favorite boy from South Africa. When he came to us, he was completely non-verbal, and in 3 years, this is a video mother sent me during COVID. So I'm just going to play this. Love this. He's making his own story and recording it himself. Completely verbal.
You white shoes. Pete loves his white shoes so much. He sang this song. I love my white shoes. I love my white shoes. I love my white shoes.
So such videos I keep getting every other day. I
Step
got
in the
a
last
similar video from
pile
a family from Greece 2 days back, saying that the foundation of stem cells really helped the child, and he is now very mild and going to a regular school. This is our aim, that children should be able to go to school. So what is the scientific basis of our work? Is all the publications. We have 109 publications in different neurological conditions, 16 in autism. All of these are publications available online. This is the book chapters that we are invited to write in different textbooks. This is a textbook called Recent Advances in Autism, where we have written a chapter on stem cell therapy in autism and our experience. A little bit about cerebral palsy. This is, cerebral palsy is lack of oxygen leading to severe damage to the brain, lead to physical as well as cognitive issues. This is the PET scan showing severe brain damage. The black is completely dead. It cannot be retrieved, but the blue areas are salvageable. General treatment, usually we give a lot of medication for tightness and spasticity and anticonvulsant, seizure medication, anti-inflammatory for pain. If that doesn't work, then surgery known as dorsal rhizotomy to reduce the spasticity, or we do orthopedic correction to correct the deformity. But nobody really looks at the brain and brain functioning, or the damage to the brain needs to be improved. This is the brain before the treatment. After the treatment, you can see the damage has been repaired. This is one of the publication, one of our earlier publication, 2015. The recent comparison. So the last one, but the recent one, this is recent data where we compared cell therapy and cell therapy with integrative therapy, and we found that even in cerebral palsy, when we combine cellular therapy with oxygen therapy, we find dramatically better results. So these are our publications. Again, cerebral palsy. This, let me show you a case report. This is a child who's 7 years old, came from West Bengal. First time in 2020, then in 2021. He was level 4 of cerebral palsy. Level 4 means, so level 1 to 5 is mild to severe. 5 is the most severe. 4 would be slightly less. He was level 4 with the gross motor function of 41%. He was not able to sit, not able to stand, walk, no speak, hand coordination not there. And after the treatment, he was able to, within a year and a half, was able to sit independently without use of hands. He was able to stand without support. He was able to walk with a walker. He started speaking in sentences. He was homeschooled earlier. He could go to school and he could manipulate, use his hands. Cognition improved. Level 4 cerebral palsy became level 3. This is the brain. You can see the severe damage, much more than in autism. You can see the cortex is also damaged. This is before the treatment, and this is after the treatment. You can see that the blue areas have all become green, yellow, and red. Green, yellow, red here indicates good functioning brain. There was severe damage in the MRI as well. So this let's look at another child. Another child, 11 years old, of West syndrome. West syndrome is not only severe brain damage, but also a lot of seizures. He was very, very severe. He came to us when he was 9. Now he's 12 years old. So over a period of 2.5 years, we have seen from no neck control to neck control in certain position, from unable to roll independently, now can roll. So the trunk muscles have improved. Unable to sit even at the age of 9, he was completely like a small child of 6 months. So he has improved in different parameters. Seizures also reduced. His gross motor function went from 6 to 14. Head control was only 1 out of 3. Now it is 3 out of 3. So let's look at his brain scan, severe brain damage. So some part of it was salvaged, not completely, but at least something is better than nothing, isn't it? Let's see whether we can find his video. Yeah. So this was balanced very poor in 22. You could see hardly. Then slowly sitting balance improved. Neck control became better. He was able to keep his hand more straighter. Then further increase in 23. This is in a moving swing. So not only static but dynamic also. And then all fours. Earlier he needed so much support, 2 people in the back, 2 people in the front. Then 1 person in the back, 1 in the front with very little support in the back. Then kneel sitting, kneel standing, you can see that to give so much support from the back initially. And now you can see he's smiling, is more comfortable. You don't really need to hold him completely, you need some support in the back. So it's so much better. Earlier he needed complete support in the back, in the front to stand, to make him stand, and now he is able to hold his body much better. So from nothing he has come to this. It's a slow and steady progress, but you must understand till the age of 9 he was doing nothing. So 4.5 year dyskinetic cerebral palsy child, again very, very poor functioning, has slowly improved. Four-year-old, she had no neck control, no sitting, so she started, and then you can see it's full support to much less support. Alignment is better. So this is dyskinetic, so there's a lot of movement. So it's not just the power, but the movement which is a problem. Unnecessary movement leads to inability to control the body. Slowly she is improved, attempting sitting to sitting, sideline to sitting, attempting more you can see cognition also improve as her brain became more functional. This is a child who was completely on the wheelchair from Kenya, 14-year-old quadriplegic CP. Over a period of a year, he showed good improvement. He was quadriplegic, but he was cognitively good. He was going to school, a regular school. So he started improving in his upper body function, hand function, ability to do small fine motor activity, with support, walk to the fridge, take out the bottle, open it, drink, which is a big deal for him. And from not being able to walk to be able to walk without support. So this is where he reached in a year. So I think I'm going to now wrap up with intellectual disability. Again, this is a first ever study which showed proof of concept in intellectual disability cell therapy. We did a comparison of 29 with intervention, 29 in the rehabilitation group. So even only with rehabilitation, which is orange, you can see an improvement. See, the orange graph is there in all parameters, cognition, remote memory, problem solving. But what you can also see is that in the intervention group, you get significantly more improvement. That is a blue graph. This is just to show the comparison. And what is important, I feel, which is, I'm sorry, I missed, is that in the rehabilitation group, you will get improvement which is mild, more mild to moderate, while in intervention, you get more significant improvement. So these are our published data. These are our books. I'm not going to show you any case report because I want some time for you to ask questions to me. Okay, complications, no major complications, no irreversible neurological reversal or deterioration, but we do see epilepsy in a few children who already have a history of seizure who has an abnormal EEG. There is a 3 to 6% chance of having a seizure, but with proper anti-epileptic cover with medications, we can reduce it to less than 3%. A spinal headache is seen every week that we do the treatment in at least 10% of the children. Sort of 52 to 3-4 may have a spinal headache, which is self-limiting, becomes okay in 2 to 3 days. There can be nausea, vomiting, and pain at the site of procedure for 2 to 3 days. These are sometimes a little increase in hyperactivity may be seen for 2 to 3 days, maximum up to a month. Very rarely up to 3 months, but maximum several between 15 days to a month. Seizures as a possible adverse event has also, we have published this negative data as well. Our work is all monitored by institutional ethics committee, which is registered with the health ministry of our country. So in conclusion, management of autism is a combination where cell therapy is the peg around which all the other therapies will work the best. So in conclusion, neuroimaging technologies are giving us greater information to understand which part of the brain is affected in autism. Newer biochemical investigations are giving us a better understanding of the metabolic pathways involved in autism. A new comprehensive multidisciplinary treatment approach involving cellular therapy with rehabilitation, with integrative therapy helps in addressing all the underlying pathologies and help improve quality of life in children with autism. These treatments are safe and effective. To be noted, by itself, cellular therapy is not a cure for autism or CP. It has to be combined with conventional and comprehensive treatment. And presently, it is not a standard of care, but it is a clinical option. So a comprehensive holistic approach for autism and cerebral palsy combines neuro brain imaging, conventional rehabilitation, special rehabilitation, cellular therapy, and oxygen-based integrative therapies. So all of this was presented in today's talk, and we believe that to get the best results, absolute acceptance of the way the child is, complete understanding of what is happening to the child, and the whole family working as a team, having the schedule in a day, along with cellular therapy, comprehensive rehabilitation, and correction of micronutrients and integrative therapy. All of this together gives you the best result. These are the books that have been published by Neurogen. All of these are available for free on our website. We have treated over 15,000 patients from 103 different countries. This is a message written by our Honorable Prime Minister for one of the books that we had written. Dr. Sharma giving the book that we have written to our Prime Minister. And the Prime Minister talking about...
जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहाँ एक नोबेल लॉरिएट साइंटिस्ट याकामाहा को मिलने गया। मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है क्या है। हम गए तो वहां गए, उनसे चर्चा की और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें।
So this is, of course, the Prime Minister of one of the biggest democracies in the world, and this is the President of one of the...
Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate a severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. Today, with the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary.
So with this very
scientists believe...
I would like to conclude. Thank you so much for your patient hearing. I did tell the outset it's going to take an hour and a half to go through the whole presentation. So this is our website, you can reach us and we'll get back to you as soon as possible. And once you've decided, you will be assigned a coordinator who will assist you through the process. We have two types of program. We have a 1 week program and a 2 week, starts from Sunday and finishes on a Saturday. A 1 week program, a 2 week program where we add integrative therapy would start on a Sunday and finish on the next Saturday. How are we different from other centers? How is Neurogen different? That we are the only cell therapy center which exclusively treats only neurological conditions. We use safe autologous cell therapy, and which is injected into the spinal fluid directly, which is the brain. We combine cell therapy with comprehensive rehabilitation and oxygen-based integrative therapies. We have treated over 15,000 patients from 103 different countries, and we have, over the last 16 years, we have a team of very senior and experienced professionals across many specialties who oversee all the work. We have the largest number of publications in the world, 109. We have written chapters in international textbooks, and we are constantly researching the cause, the nature of the nervous damage, and what are the new treatment options which can work synergistically. And we have an institutional ethics committee approved by the government, which monitors our work. So this is a journey of hope, a combination of cellular therapy and integrative therapy. And we hope that this presentation has given you some insight over this possible hope. This is us, and feel free to reach us at any. I'll be now taking questions. I hope this has been insightful. There are few people who have questions. So I'm going to go straight to the question. Krishna wants to know, what is Neurogen take on exosome therapy along with sensor, as some other clinics are doing? In Neurogen, planning to do OAT test as part of list of investigation. So OAT test is very similar to the gut microbiome test. I find that we get similar information about whether there is a fungal overload or there's a bacterial overload and imbalance of amino acids. So a lot of information we do get from the gut microbiome test. In case of exosome, exosomes are released by stem cells. So in fact, recently I attended a talk in the Bahamas where one of the very expert in exosomes gave a very intensive talk saying that exosomes have to be properly understood. Just someone saying that they're injecting exosomes may not be exosomes. It may be just protein particles. You need to have proper quality control. Where are the exosomes sourced from? When they are injecting the exosomes, they're injecting into intravenous. Do they really reach your brain or not? So stem cell per se release exosomes. So that is one of the mechanisms. So we don't believe in adding exosomes when there is already we are injecting the source of the exosome into the spinal fluid. So exosome, when people say exosome, please check, understand where are they sourcing it from, what is the quality of it. It is not as simple as just injecting. It has to be properly kept in the right temperature. If the temperature is not maintained, the exosomes degenerate, and what they're injecting may be just water. So whenever we do any kind of treatment, we add treatments, or we do a test, we do a lot of research before we introduce it. So at this point, exosome is not in our treatment process or part of our comprehensive treatment till we are sure that this is something which will add value to the treatment. We will not be doing it. Nazia is saying that I'm confused about bone marrow derived stem cell and donor cell therapy. Some say donors are fresh, so it is more beneficial for the child. The bone marrow is taken from the child's own body. It is freshly taken out. It is processed and injected within a few hours. So in fact, child's bone marrow is the freshest. Children have very good cell count, better than any adult. So our experience says that taking from the child is the best. Now, when we take from donor, it is like an organ transplant. It can be rejected by your body, even if it is your sibling. So just think about when there is a bone marrow transplantation for blood disorders, like if somebody has sickle cell anemia, you have to take a donor cell. In that case, you have to first suppress the immunity of the patient giving immunosuppressant drugs, and then the bone marrow transplantation is done. This itself is a very, very morbid process. So I do not know how people are saying donor cell therapy is better. Maybe they mean donor cell, maybe they mean cord blood cells taken from the umbilical cord. I think what they mean or they claim is that the cord blood cells are younger or less mature than bone marrow cells. Yes, theoretically that is true, but bone marrow is also the cord blood cells are stored in -190 at -190 degrees centigrade. It is cryopreserved. In fact, it is not fresh; it is cryopreserved. So you just imagine, do you think that you will take the cord blood from a child who is just born and inject into your child? No, this cord blood, which is from a newly birthed child, is taken to the laboratory. It is checked. It will have to be checked for viruses. It will have to be checked for viability. The numbers will have to be counted. Then it is mixed with cryopreservant. Then it is stored in the laboratory, and when your child needs it, it will be revived. Now, when you take it out of a cold preservative, when it comes out, you will find that first that cryopreservative has to be completely washed out. It is known as dimethyl sulfoxide, which is an extremely toxic chemical. So unless it is completely washed off, it is toxic to the body of the child. And that's why even if you wash it out completely, even one drop remains, you can give it intravenously, but you cannot give it safely into the spinal fluid. It will be catastrophic. So what I think they mean it is younger, it is not fresher, for sure. What is the cutoff age for stem cell? My child is going to be 10 in October. Do I have a chance? Absolutely, Shukriya. Your child has a very good chance. There is no cutoff age. The youngest child we have treated is 8 months old, and the oldest individual we have treated is 80 years old. But what we mean by age is that as the age increases, the chances of success reduce by 5%. So 10 is a good age. Earlier the better. Do not delay, because you don't want to end up at 13 and 14 and keep wondering whether I should have done it at 10. So 10 is a good age. Do not worry. Yes, yeah. So next is Nigeri Kamau. Do you do heavy metal testing? If you do, what's the treatment protocol in terms of detoxing? I do not personally believe in heavy metal testing. We can do heavy metals testing, but as a protocol, we do not do heavy metal testing in our protocol, because heavy metal testing, if the heavy metals are there, then they will need detoxification using chelation. That is not really recommended in children unless it is very high, the heavy metal is very high. So as a routine, we do not do it, especially after the cell therapy or stem cell therapy. Chelation is not recommended. On the other hand, ozone itself is a natural detox. If there is some heavy metal in the blood, it will get detoxed. And glutathione sprays can be used for detox as well. So as a routine, no, we do not do. But if you want, we can do it. If you ask me, I would say don't get into it. Mariam, my child has cerebral palsy. He is 3 years and not smiling as yet. How can we stimulate him to smile, and how do we stimulate his eyes, as we don't know if he can see, he can perceive light through. So you have to do vision therapy. In a dark room, you put light in front of his eyes and keep moving the eyes. You have to keep moving the light, different kinds of light in front of his eyes. That will help him learn to track. So that is called visual rehabilitation. Do a lot of stimulation, not 1 or 2 times, multiple times in a day, and keep doing it continuously. So maybe he has a problem in the optic nerve, or there can be a cortical visual impairment. A lot of stimulation will be required for this child. What is the maximum age to do cell therapy? Patricia answered that. Depends on the condition. In stroke patients, we have done at later age also. But the best age in autism is, of course, before puberty. But we have treated children for 15 years or 18, 20, 25 also. Older children can be treated. Only the prognosis or possibility of success reduces by 5% every 5 years. In type 1 diabetes, can stem cell repair pancreas? Avleen, our expertise is not diabetes, but from what I have heard, there are centers in the US who are doing mesenchymal stem cell injections for type 2 diabetes, not type 1 diabetes. So the cells in the pancreas may not repair, but they may get stimulated to produce more insulin. So you may not get a complete reversal, but you may get a better HbA1c level, a better control on the sugar levels, better adaptation, and maybe reducing the dosage of insulin. But a complete reversal is not seen yet. Edmund, is the presentation available later? Yes, you will get the video recording of this presentation since you have registered. How effective is stem cell therapy for adults at 30 years old? Edmund, depends on the diagnosis. So yes, we do adults also. We treat adults with spinal cord injury, head injury, stroke, muscular dystrophy. Yes, we treat adults as well, hypoxic injury. It is effective as well, but we will need to understand the diagnosis. Is upper motor neuron lesion a type of cerebral palsy? Cerebral palsy has upper motor neuron lesion. That means, what is upper motor neuron? Upper motor neuron is the cerebral cortex, the brain cells. If brain cells are damaged, it is a motor part of the brain is damaged. It would be a motor neuron damage leading to cerebral palsy. The cause would be birth injury or hypoxia. I'm not really sure what exactly you are trying to ask. Please do get in touch with us directly and I will be better able to answer you. Dhaval, 3 times you have done and this year you want to skip, do next year? Yes, why not? If you have done 3 times, the cumulative effect of the 3 times will continue. Please continue the rehabilitation, very important. If you have not done a gut microbiome or anything last year, then please do a gut test. Definitely you can skip this year and come next year, no problem. I hope your child is doing better. Naveen, Dr. Nandini, thank you so much for your presentation. Are there A/B test results similar to only cell therapy versus cell therapy plus integrative for results with and without gut microbiome, post stem cell therapy and integrative therapy? We are still analyzing the data of the gut microbiome and others. These analysis and assessments take time. We keep evaluating our data both about gut microbiome and all these. It's a work in progress. Hopefully soon we will come up with that data. We're still analyzing that data. Will stem cell therapy help for cerebral palsy? Grace, yes, stem cell therapy will work for cerebral palsy. How many stem cells do you inject in a single procedure? Sarath wants to know. So what we are injecting is mononuclear cell concentrate from the bone marrow. We take, based on the body weight, we will take the bone marrow. We stimulate the bone marrow using granulocyte colony stimulating factor, which increases the counts in the bone marrow. Typically, what we find is about 100 million to a billion mononuclear cells are injected intrathecally. So please understand the difference. Intravenous efficiency is less. You need to inject more. Intrathecally, you need lesser cells. Rinda, thank you for the wonderful presentation. Would Neurogen consider FMT in the future for kids with severe gut dysbiosis? We have been evaluating. We are still not convinced about FMT. Please understand that FMT, single session of FMT is not useful. We have been talking to practitioners who do, they say at least 30 to 60 sessions of FMT, 1 per day is required to get any benefit. So at this point, after evaluation, we are not convinced of the synergy or of the effectiveness. In the future, if we do get convinced, we are open to being convinced about the utility. Even when we added hyperbaric oxygen, we took time to add hyperbaric oxygen. We did our own research. We understood the concept. We understood whether it would work. Practically, how does it work? So then we added. So anything that we add, we do a lot of research before we add, not because it is popular and people want it. It's because we believe that this will help our children. What is the recommended time gap between 2 procedures? A minimum of 6 months is highly recommended. You can go between 6 months to 9 months. If the child is older, then stick to 6 months. If the child is younger, you can do 9 months to a year. Miriam, you mentioned the umbilical cord. I really didn't understand what exactly you said. Can a mother donate or where do you get it? Umbilical cord is one of the sources of stem cells. Umbilical cord is a connection between a child and the mother when the child is born. When the child is born, at that time, the cord gets cut and goes into the dustbin. many people choose to store the blood which is there in the cord, that is known as a cord blood. So mother cannot donate it. It can be procured only when the child is born at that time. We do not use cord blood cells. We do the treatment with the child's own bone marrow. So it is good enough. It is better than the mother's, in fact. Namita. Oh, I missed Namita. If I missed any question, please write again. What is integrative therapy, similar to ABA speech, OT, or is there any training for parents? Integrative therapy, we call the process of hyperbaric oxygen therapy, ozone therapy as integrative therapy. Call it oxygen-based integrative therapies. If you have attended my talk completely, I have explained about it. Aisha, Diogo, what can you do if your child is having too much calcium in his body? Too much calcium, we'll have to check the calcium should be detoxified by your own body. We need to check what calcium, why will the child have more calcium? How did you come to that conclusion? So when you are doing the hair is not a very good, is not a very good sample to know what's happening in the body currently. So do a blood test, do a urine test. If your blood shows high calcium, then you won't need to go to the pediatrician and get a consult. Because calcium generally gets detoxed by your kidney. Can we offer HBOT ozone therapy 2 months after stem cell? How many sessions required? You can do HBOT later also. Please understand that HBOT on its own, ozone on its own is effective. And if you just to add to what your question also similar. So you can do HBOT ozone later as well. When you do closer to the cellular therapy, you get a synergistic effect. You can do it together. And if you can start HBOT now, no problem. Please start it. It will be effective. Now, how many sessions are required is based on the age of the child and the weight of the child. A child less than 6 years, we recommend not to do more than 30 HBOT sessions in a hard chamber. And child above 6 years, not to do more than 40 sessions. This has to be finished within 2 months. Then the cumulative effect or the oxygen adding up will be effective. What testing is done? Anonymous, certainly your question was half. Sayak Datta, if child is undergoing homeopathy and Ayurvedic, can that still be continued? We have no problems with homeopathy and Ayurvedic treatments, but generally because we don't know how it will interact with the treatment that we are doing with the cell therapy, with the supplements, we suggest that you stop a few weeks before and hold for 1 month at least. Check with us before restarting the treatment. Homeopathy, if it has been helping your child, then you can continue after a month. Ayurvedic, you would like to see that if it has any heavy metals or any issues. If no heavy metals, it's only herbal, you can start, but wait for a month after the procedure. Stop a couple of weeks before. What type of testing is done on the second stem cell treatment? What type of testing? We do the blood workup that was done before. The same blood workup is done again. And we do a comparison PET scan. If gut microbiome has been done before and you have taken the complete treatment of the gut microbiome, we will do a comparative gut microbiome. So these, and EEG, of course. We do not do MRI again. Vrinda, does stem cell also repair demyelination tissue synaptic issues? Yes, absolutely. Melissa wants to know if autism is totally curable. We do not consider autism as a disease. It's a condition. Children can come off the spectrum. If the child is moderate to severe, can come to mild to moderate. If the child is mild to moderate, can come off the spectrum. Yes, clinically. Sarath Kumar, what are the typical tests do you recommend for a child along with stem cells? I just I think answered this, Sarath Kumar. Blood workup, which contains hemoglobin, that is CBC, serum electrolytes, creatinine, liver function tests, blood sugar levels, thyroid function, vitamin B2, B6, B9, B12, vitamin D, and a triple H homocysteine, MTHFR gene mutation test. Then we also do gut microbiome. We do MRI brain, PET CT scan, and each. In a FISA, if you have 80% success after 6 months, what happens to the 20 in stem cell therapy? Please explain why 20 was unsuccessful. There are so many. See, any treatment, the less likely that you'll have a 100% success rate. So we are upfront about it. 20% generally, children who are very severe, who have comorbidities like severe seizures, hearing issues, vision issues, and those who have not undergone rehabilitation properly, we believe that these are the children who will not show any improvement clinically. On the brain scan, all those who have come to us, we find that every brain scan that we do, we see improvement. It may be 5 or 10% improvement, or it may be 50% improvement. But the hardware, the brain functioning definitely improves. But does the child always show an improvement clinically? Not always, because if you have not used the hardware, that's why we keep on focusing on the hardware and software. If you have not used the hardware, if you have not put this proper software, you will not see clinical improvement in the child. Shukriya, how long does the treatment take? How many days do we need to stay in your hospital? Could be more than 2 weeks. A minimum of 1 week up to 2 weeks is the stay. If you want to stay longer for rehab, then there are people who stay outside, take up a rental place and come for OPD for rehabilitation. But 2 weeks is good enough. What age is old? What is younger? The youngest age for autism is we have treated as 14 months. Oldest would be like a 30, 35. Miriam, my son has autism, CP, ADHD, and epilepsy. Can procedure cure all of it? It's a one at a time. The cell therapy will not cure the epilepsy. There is a 3 to 6% chance that epilepsy may get stimulated. Epilepsy needs to be controlled with medication. But yes, autism, CP, and ADHD all arise from the brain. So that means the different parts of the brain are affected, and that can be treated. I will not use the word cure here. It can be treated for sure, Miriam. Namita Pai, gut microbiome test and inborn error of metabolism. Same. No, Namita. Inborn error of metabolism is a blood test. It is done when the child is born and appears to have some either congenital condition. Gut microbiome test is from the stool. The stool of the child is tested for whether there are what kind of pathogens there are, whether there are good bacteria, bad bacteria, what is the imbalance, if there is fungus in the stool, if there is worm infestation, whether the different vitamins are being absorbed properly, how are the hormones, or how are the neurotransmitter production. So that is from the stool. So these are 2 different tests. Would PRP injection synergistically help with stem cells? Thank you. If so, how much gap is ideal between? No, PRP has no relevance for autism. PRP has more relevant for wound repair, or it may have for knee, for arthritis. PRP doesn't have any role for neurological conditions. Child needs to be toxin and parasite free before the procedure? Not necessary. We are looking at the brain functioning. We can do simultaneous detox of toxin and parasites because we are taking from the bone marrow, injecting into the spinal fluid. Nothing goes into the blood, so it is not required. It can be done parallelly. Somebody is raising hand. Do you want to put question here? iPhone, somebody named iPhone. Have I answered all the questions? If not, tell us about TMS. Not an expert in TMS. We have not really evaluated TMS. So let me explain this. There are hundreds of treatments that are available and can be used for various neurological conditions. And at this point, we're talking about autism. When we look at what works best together, we do research to see our main treatment is cellular therapy. What will work with cellular therapy synergistically without clashing with it? That's where we found that neurorehabilitation stimulates the brain and the cells. So cell therapy and neurorehabilitation work beautifully synergistically. Then we, as I said, we studied hyperbaric oxygen, we studied ozone, and we found that there is complementation here. So that's why we put it together. The nutrients, we look at the nutrients, we can correct that. That doesn't clash with the stem cells. The gut microbiome clearance doesn't clash with the stem cells. So that's why we know this team works well. Ayurvedic on its own has good, homeopathy on its own, but we don't know whether it will work with our team. So that's why we say keep it a little aside. Now, we had in the past looked at neurofeedback. Now, neurofeedback, TMS, MERT, these all work on a different principle altogether. They look at the frequency of the different waves in the brain. So the concept is completely different, and that's why our collaboration with neurofeedback didn't really pan out. So that's why we believe that if you're doing cell therapy, do not add wave or frequency correction processes with the cell therapy. It may not work, because we have studied only neurofeedback. We have not studied MERT and TMS. So MERT and TMS on its own may be doing a wonderful job. Frankly speaking, I would not be the right person to give you inputs on that, but we have got anecdotal feedback from some parents that they did cell therapy, and after a couple of months or after a month, they did the MERT, magnetic resonance therapy, and they found that whatever gains they had with cell therapy regressed. So that's why we are a bit circumspect about suggesting MERT or TMS after the cell therapy. So that would be my answer. And I will try and read up more about MERT and TMS, and maybe in the next webinar talk a little bit about it. Can we use any particular probiotic for the gut before stem cells? You are most welcome to use probiotics. From our side, no problem, because even with the cell therapy, when we give 2 days of antibiotics, we give probiotics as well. Please do use a probiotic which suits your child. In autism, it's sometimes very strange. Something works beautifully for one child, the other child will react completely differently. So do try probiotics. There is no harm. Sometimes it may lead to a little constipation. So if there is constipation, pull the probiotic. Give the probiotic once the constipation is cleared. Can you share the website again? Thank you for detailed presentation. I've learned a lot. Most welcome, Miriam. Yes, the website is www.neurogenbsi.com. neurogenbsi.com. We're putting it in the chat. Please check it out, and you will get a video link of this particular video in your email. Sound frequency for speech stimulation, similarly, Mercy, we are still studying it. Again, it is wave frequency. So unless we really study the principles and how it works with the stem cell therapy, I would not recommend at this point. But on its own, without the cellular therapy, please go ahead and do the sound frequency. I've seen it work for some children, yes. David Meko, what kind of medication do you execute for kids with mild autism or hyperactive with minimal speech? Medications, how bad is the hyperactivity? If the hyperactivity is unmanageable, then we suggest risperidone or Sizodone. Recently, we have started using magnesium. Magnesium biglycinate as a supplement helps reduce the hyperactivity on its own. You can use citicoline and paracetam combination also to help reduce the hyperactivity. If the hyperactivity is not too much, try supplements and neuroprotective agents rather than risperidone or aripiprazole. Go to those antipsychotic medications only if the other methods doesn't work. Also suggested for hyperactivity is diet. Work on the diet. Try and reduce casein and gluten in the food. Avoid sugar. A lot of hyperactivity will come down. Also, you could try a lot of physical activity. Do a lot of physical activity, which is directed physical activity, not what the child is doing, but directed, like running properly, or football, or cycling or swimming helps to reduce hyperactivity as well. Will broccoli therapy work for autism? Any info on this? Sulforafan. I will need to read up. As I said, there are hundreds of treatments. I do not claim to be an expert on everything, but let me read up on this, how it works. Sulforafan, broccoli therapy. I'll read about it and maybe talk about it in one of my Instagram lives, which I will be starting next week. Can we use NAC and glutathione at the same time? Tell us more about methylation. Okay. Yes, NAC and glutathione are good molecules. N-acetylcysteine. So we are routinely giving glutathione spray, especially after anesthesia, to help the children recover because there are methylation issues. So I spoke a little bit about methylation in relation to folic acid. That will require a complete different talk and lecture, which will be very scientific. Methylation issues, most of the children do have methylation defects, as I said, evident from the MTHFR gene mutation test. 80% of the children have a gene mutation test, either heterozygous or homozygous, leading to methylation defect. That means the methyl group of methylfolate is not available for the downstream molecules, like for homocysteine. From methylfolate, the methyl needs to get transferred to homocysteine, and then the GABA is formed downstream. So methylation defect one affects the formation of neurotransmitters, also prevents recovery from illnesses. So and that's the facet we are working on. We are also looking at other methylation donors like methylcobalamin. So when you're giving B12, please ensure that you're giving methylcobalamin. So this is as simple as I can get. More about glutathione, something routinely, but NAC, we have not yet started for adults. With neurological condition, we do give intravenous N-acetylcysteine and glutathione. In children, we do not prefer giving intravenous. We have not introduced NAC orally in children yet, but we have introduced glutathione spray. Now, one thing we have to understand is that when we are giving supplements, we have to look at two aspects. One aspect is in what form are we giving these supplements? Number two, whether these will reach the brain, because finally what we have found is when we are looking at blood nutrients versus CSF nutrients, that there is an imbalance, that in the blood you may get a high level, but in the brain it is low. So how do we bridge this gap? So glutathione in a spray form reaches the brain, but we do not know oral glutathione whether it will reach the brain. Similarly, we have to find a way for the NAC to reach the brain. Then only the methylation in the brain will be effective. So there are a lot of, so just giving supplements blindly. Now again, supplements have to be given in the right form. They have to be in the activated form. So cobalamin, the B12 and B9 has to be methylated. The pyridoxine has to be phosphated. So all those activated vitamins are very, very important. Just giving supplements is not enough. So about methylation, maybe I will do a separate webinar only talk about methylation, because that will require a lot of graphs to be able to be more, easier to understand. What type of magnesium is good for autistic? What should be the dosage? Yes, magnesium biglycinate. We find that magnesium biglycinate works the best, better than magnesium oxide and citrate. So magnesium biglycinate, I think we are giving 500 milligram OD for children. Or you could start with the 250 milligram, that is half of 500 twice a day. Start with 250 milligram once a day, see how the child is doing. If the child is able to take it, then go to 250 milligram twice a day. Who should use to boost speech apart from speech therapy supplements, since we have done severely but still non-verbal? What about methylfolate and leucovorin? Have you tried that? I think that is really helping children come out with the speech. And maybe we need to give it for a longish time. So earlier we were giving 3 months on, 3 months off. We will continue to give it for 6 months to a year. Methylfolate and leucovorin. Please test for MTHFR gene mutation. I hope you have been told. I don't know your name, otherwise I would have reached out to you. You can please put down your name, so I will ensure that someone reaches out to you. Any other questions? Oh, thank you for staying on for so long, despite the long presentation. I'm happy so many of you still continue to be online despite the late hour. I hope this has been useful. If there are any more questions, please send us an email and we will send you this, and I hope this has been helpful. Thank you so much, and I'll be logging out now. Have a great